our listeners to do differently after hearing this conversation, what would it be?
If you're overweight, lose 5 kilograms. And if you don't exercise, exercise 3 times a week
3 times a week for how long?
for the rest of your life.
Okay.
I think he meant by the
Yeah, the
duration.
duration. Welcome to another episode of NUHS Care to Talk. I'm flying solo today because my co-host is also flying solo. She's on holiday, but not to worry, I'm joined by two very esteemed guests. I've got Prof. Aymeric Lim here, who's the CEO of NUH, and I've got Dr. Cheah, who's the Chief of Population Health and Community Care at NUHS. So welcome, gentlemen.
Thank you.
So let me start with you, Dr. Andre. Your designation has population health in it.
Yeah.
And it's quite interesting because, when you read the news, it's quite obvious that the government is pushing towards that aspect, population health. What exactly is population health?
In a nutshell, population health is the science and practice of raising the health or the well-being of the population as a whole, not just treating individual patients. An example of this would be screening efforts. That helps population health when you go out to people who do not feel sick and check if they have something that may be brewing, and then give them the follow-up that they need.
Right. And Prof. Aymeric, so how does NUH as a physical hospital align with this initiative? I mean, it sounds like if Dr. Andre is successful in helping keep the population of the West healthy, then NUH can pangkang already, right?
Yeah.
Well, our aim is the same as Andre's. We want Singaporeans to be healthy. And whereas his efforts will be in the front line, ours were right at the back. And when patients who are really ill come through our doors. But our aim is for patients to be healthy. So the fewer that come through our doors, actually the better it is for Singaporeans and for our country.
We do hear also that hospitals are getting busier today. I think there's an aging population. So does that explain the push towards the need to move beyond hospitals and towards the community?
At the risk of angering Aymeric, let me explain what acute hospitals are like. Acute hospitals are set up to manage scarce resources. So we optimize around the scarce resources. So that means we're optimizing around the doctor's time, the scan room's time. And maybe it's harder to optimize around the patient. In the community, we have the opportunity to do that. We can be more relational because we can possibly see the patient more. We are closer to the patient. We can be more motivational because we have the time. It's not that the acute hospitals don't want to do this, but like I said, they're optimizing very scarce resources. So time is something they may not have. And if you're talking about prevention and population health and getting people healthy, activating them is the main thing to do. And for that, you need motivation, you need relations. And I think the community is well placed to do that.
Prof, did he anger you with his answer?
No, not at all. To carry on Andre's prevention analogy, we all know that prevention is better than cure for anything in life, right? And if he's successful, which he will be, the more disease that we can prevent or the more ill health that we can prevent, the more resources that we will have to cure patients who are truly ill. And with an aging population, it's inevitable. The older you are, the more health care problems you'll have. No matter how healthy you've been in your life, you will fall ill and you'll have things that break down, like cataracts, like knees. And we need to preserve those resources for patients who need it.
Let's take a 65-year-old resident with diabetes and high blood pressure. How might that patient's care journey have looked like in the past, and how is it different today?
In the past, and let's pick any random patient, not necessarily with hypertension and diabetes, someone who has not had any diagnoses. So his conditions would have been picked up randomly or opportunistically. So, for example, he has cough and cold, right? Very bad sore throat. He goes and sees his GP. GP monitors his blood pressure and finds, wow, it's been high. It's pretty high, 170 over 100. And that's how it's picked up. And he's probably had it for the past 5, 10 years already. During that time, it would have calcified the arteries in the heart and maybe start to cause problems in the brain. That's one. So not so serious, but still serious. Another way how conditions would have been picked up before is that, say, you suddenly go to the emergency department with vomiting blood. All right, that's pretty serious, right? And that could be ulcer, could be cancer in the stomach, could be a couple of things. And so they would be picked up like that when it's patient is ill and it's very serious. And that's how it used to be.
I agree that may have been the case in the past. Now we have quite a good system, right? We have I just call it a wraparound system. We have our general practitioners at the center of care in the community for health. They have community nurses to back them up. They have the social service agencies, which manifest physically as the active aging centers, all as a system that is quite patient-centric. It wraps around the system. On top of that, this system then delivers on a program that is, evidence-based. Smart people have thought through them. It's called Healthier SG,
Okay.
right? HSG. If you enroll in Healthier SG, you get your hypertension screened, diabetes screened, high cholesterol screened. You'll get the 3 important cancers screened. That's colorectal cancer, breast cancer, and cervical cancer. So all our patients need to do, our residents need to do now, when they're above 40, is just sign up for Healthy SG. Simple.
So we also often hear that keeping residents healthy takes a whole of community effort. So what does that really mean? How do family physicians, community partners, social agencies, and even doctors and clinicians in the hospital and nurses, allied health, etc., how do they contribute to keeping residents healthy?
There's a large segment of the population in Singapore who are literate in health and also directed. Then there's a middle part that need prompting. And there's a third segment of the population in which they're not that literate in health-wise, and also they're not really directed. And they need a lot of family support and also community support. And that's where community support comes in.
There are the social service agencies, the community partners, that means People's Association and the rest. And don't forget the general practitioners. And last but not least, of course, us, the regional health manager, that I think we have the responsibility now for being the architect of the system, trying to put everyone together, trying to align everyone's interests, making sure that the health of the population is something that they care for as well. Social service agencies may have other missions, but given their reach, they can help us in this mission, also our mission for population health.
But that's coming from the perspective of those who are helping the community stay healthy. But from the community's point of view, how do you help them trust these players, right? Because I think the traditional mindset is that, if I'm sick, I go straight to the hospital. So how do I trust that maybe, the community partners, social agencies, family physicians are really best equipped to help me with my care journey?
Well, this sounds a bit cliched. I'm going to say it anyway. It's about relationships. So the community partners, social service agencies, they are proximate, or they are close in proximity to our residents. And the more they interact with them and the more they help them, the more the patient or the resident will trust them. So I'll give you an example. If you look around, you ask your family members or even my patients, they would trust, let's say, their hairdresser more than a doctor that they have met for the first time. Because this hairdresser, it's funny for me talking about hairdressers, but this hairdresser has been with them for years, right? They have conversations every 3 months. And the hairdresser says, yeah, your knee pain, you should take this thing. And they believe it. They believe it because there's this trust from the relationship, not from the qualification. Again, I'm not saying that hairdressers have no qualification, but what I'm saying is that in the realm of knee pain, they are not trained in knee pain, but the client will listen. So summary is relationship built on multiple interactions that is of value to the resident, not necessarily in health.
From a hospital point of view, although doctors, clinicians and nurses and allied health also, they've got the qualifications, but also I'm sure sometimes you all face patients who don't really trust your how do you all build that trust, and how do you think it can translate into what Dr. Andre was saying, building trust within the community as well?
I think our public health institutions as a whole are very trustworthy. And in a teaching hospital like NUH, the advice that we give is the advice that's in the textbooks, and it's evidence-based. So whether the patient wants to listen or not, or receive it, the advice that's given, the medical opinions, are trustworthy because they're based on evidence. Next would be the contact with the patient. So of course, if the doctor is empathetic, listens to the patient, and really understands what the patient's trying to tell the doctor, usually trust will develop. And this during the course of a single consultation. So the trust, number one, comes from the information that we give, which is true.
You have like a secret tip for how you build trust with your own patients?
I would say I tell the younger doctors when the patient comes in, like Andre, I teach him how to see the patients. When the patient comes in, just keep quiet for the first 5 minutes and let the patient talk. And sometimes the patient will tell you things that are not related to, say, the hand or something like that, which are also very important. The patient may be depressed. There may be something happening at home. And for me, the number one tip is to listen to the patient.
I follow up on that, and I say something, or I paraphrase something of his teacher, okay, who then told me stuff. And people are always telling me stuff. So he said this: you should listen to the patient, and whatever they say is a problem to them. It may not be a medical problem, but it is a problem if you have to address it. You may not be able to solve it, but first you have to address it, acknowledge that it's there. And in this day and age where we are a little bit more connected to social services and all, if it's a matter of social insecurity, at least we have resources on trying to help them deal with it. So let's say someone is having problems with bills, for example. Okay, at least we have the resources or the know-how on where this is, where the help is. So it's, again, this, in essence, listen to the patient and address their problems.
I think we all can agree that trust between the patient and clinician and even the social agencies and the community partners is going to be very important if we are going to progress and help the population stay healthy. So what role do doctors, nurses and allied health professionals play in helping residents stay healthy? Not just treating them when they fall ill, but helping proactively to keep them healthy.
It's a mind shift change. And that's one thing. And two, it's an organizational change, as Andre mentioned, that we have to move upstream and we have to catch problems before they become serious. So basically, the best way of doing that is staying healthy. The second, if the problem does develop, the next line is screening. Yeah. Do you agree with that?
Yeah, I agree. I'll say a little bit more about this. So this, you mentioned doctors, nurses, allied health professionals. These players in our system don't necessarily reside only in the acute hospitals. No, now we have them everywhere, including the community. So the whole idea is that when the patient is quite well, they'll be in a community. If they do get sick, they are nicely handed over to the acute hospitals. Hopefully not crash landing into the emergency department, but way before that. And after they're made better, made whole, they will return smoothly in a well-coordinated fashion back to the community. This will involve doctors, nurses, allied health workers working in these different areas, and even across these areas, they may move. So that's I think how they might be.
So it's like a whole ecosystem.
Yeah.
From community, it needed go to hospital, back community, and then it's just
With no drop balls.
no drop. Yeah.
But I think the car analogy is also a good way to think about it and helps people to understand fast. So you send your car for screening. What's the word called for screening the car?
Servicing.
Servicing, yes. You send your car for servicing every year, right? Okay. And would you rather that the car problem, say a leaking valve or something wrong, be picked up during screening or picked up while you're at a standstill on the ECP?
During screening. Yeah.
Much better, right?
Much
Because
better,
then
yeah.
everything is planned.
Yeah.
Yeah. So it's the same thing.
Yeah, I say one more thing about it. I think it resonates with Singaporeans here. If the provider is reasonable, the servicing is also much cheaper or much more affordable than
Right.
if you're stuck on the ECP and a valve has blown out or
Right.
your tire has fallen off or something like that, right?
Okay, I don't have a car, so I wouldn't know, but I'll trust you.
You can imagine, right?
I can imagine.
Yeah.
If there's one thing you would like our listeners to do differently after hearing this conversation, what would it be?
If you're overweight, lose 5 kilograms. And if you don't exercise, exercise 3 times a week
3 times a week. For how long?
for the rest of your life.
Okay.
I think he meant by the
Yeah,
duration.
the duration.
Okay, long time, half an hour. I'll
Half an
answer
hour,
for
okay,
you.
okay. What about you, Dr. Andre?
Sign up for HSG, that's called enrollment, and get yourself screened. Because we have a very good system that is very affordable, you know, just big use of it. It'll be worth the investment.
Yeah.
Just like we invest in ourselves, in our education, in our bank accounts. This one should invest also.
So I guess the lesson here is sign up for Healthy SG, go for your health screenings, and invest in your health. All right, thank you, Prof. Aymeric. Thank you, Dr. Andre. Thanks for joining us today. And I'll catch you on the next episode of NUHS Care to Talk.